Well, good morning, good afternoon, or good evening, everyone. Welcome to today's webinar. My name is Charlotte Bilo. I'm a research analyst at the International Policy Center for Inclusive Growth, and I'm very pleased to be moderating today's webinar entitled Integrating Social Protection with Child Protection Services for Better Outcomes for Children. This webinar is hosted jointly by the International Policy Center for Inclusive Growth and UNICEF's Regional Office for the MENA region. And before we start, I would actually like to remind you that translation is available. You can see the translation option in your Zoom menu if you would like to listen to this webinar in Arabic. But please be reminded all presentations will be in English, but if you prefer to listen in Arabic, that is available. And now on today's topic, as the title suggests, the main objective of our webinar today is to understand why and how social protection and child protection services can be integrated, focusing particularly on linkages and synergies, and especially the social service workforce in integrating these two fields. And we will be listening today to two case studies also to illustrate this integration or possible integration, namely from Brazil and from Morocco. And we're very pleased to have speakers from both of the countries with us today. And if we can go to the next slide. Great. So let me introduce our speakers today. We're very pleased to have a really fantastic group of speakers with us today. Starting with Bertrand Bainvel, who's the Deputy Regional Director at UNICEF MENARO, who will be providing the opening remarks. And following his opening remarks, we'll have Tomoo Okubo. He's a social policy specialist at UNICEF headquarters. And he will be our first presenter and talk about what it actually takes for a meaningful collaboration between social protection and child protection. So we're also very glad to have him with us today. And then I am also very pleased to introduce my colleague, Karen Pereira, who's a researcher at the IPC-IG. And she is actually the one of the main authors of the study that she will be presenting today, which will be launched soon. The study will be launched soon, and it provides a review of good practices in terms of integrating social protection and child protection services and presenting 5 different case studies. Karen will be presenting together with Fabio Veras, who is from the Brazilian Institute of Applied Economic Research and research coordinator at the IPC-IG. And after Karen and Fabio's presentation, we have Karima from UNICEF Morocco. Karima Kesaba is a social policy officer at UNICEF Morocco. And we're also very pleased to have her with us today. And then the second case study will be presented by Rafael Osório, who's also from the Brazilian Institute of Applied Economic Research and research coordinator at the IPC-IG. And then we'll have also a moment after these presentations for Q&A. So please remember to send your questions through the Q&A box. And we will close the webinar with our colleagues from the regional office, Javier Aguilar and Saman Tapa, who will be providing the closing remarks. So without further ado, I would like to hand over to Bertrand for your opening remarks on behalf of UNICEF MENARO. Thank you, Bertrand. The floor is yours.
Thank you very much, Charlotte, and a warm welcome to all the participants, policymakers on social protection and child protection. With a big thank you for your participation in the webinar today, which is also made possible thanks to our collaboration with the International Policy Center for Inclusive Growth. So a very warm welcome on behalf of UNICEF in the Middle East and North Africa. We're very happy actually to co-host this seminar today, as the topic is highly relevant for children in our region. The second Arab multidimensional poverty report that we conducted with data pre-COVID over 7 middle-income countries showed us that actually 4 out of 5 children in the, a quarter of children living in these countries were deprived of at least 2 essential dimensions of their well-being. And therefore, they are defined as a multi-dimensional poor. The second set of data, which makes it very relevant for us to have the seminar, is about the very high prevalence of violent discipline in our region. It's actually the highest prevalence witnessed in the world. About 4 out of 5 children aged 2 to 14 years old have undergone violent discipline at home in the 12 MENA countries that we studied. And we realized that violent discipline also frequently coincides with violence against women. And our region is also home to nearly 40 million girls who married under the age of 18. And we realize in our region, but I think it's the case in other regions, that multidimensional deprivation millions of children experience often leads to situations of violence, abuse, and exploitation. So hence the importance to discuss the link and the integration of response between social protection and child protection. So we see this webinar as an opportunity to discuss how we can facilitate this integration very practically, and when we do it successfully, what results it leads to. As was mentioned earlier, we will be reviewing results of a study titled Why and How to Integrate Social Protection, which covers examples from Brazil, Egypt, Iraq, Morocco, and Tunisia. We will see also how social cash transfers can be a powerful tool to reduce the socioeconomic stress on families, but also we will see the limitations in facilitating access to key services that are key in addressing multidimensional deprivations. As we know, the barriers to access to services are not only economical. So as part of our discussion today, it would be important to also incorporate parents' beliefs, values, perceptions in benefits, what we call the own opportunity cost estimated by families as they make choices for their children. And many of these choices often result in child marriage or child labor. We'll also need to discuss how we can turn our efforts towards reaching the hardest to reach families, as many of them do not actually come to services, and they have often fewer social links than other families have. And in this respect, I would like also to encourage all of us here, even though we are very much experts on child protection and social protection, but to open the discussions and to reach out to our colleagues working now on health and especially immunization, who are now looking at and putting their attention on the zero-dose children, the children who have never been vaccinated. And their number is growing in a few countries of the world and including in our region. So for us, it forces us to think about, who are these children? Why do not they get any vaccination? Where do they live? What stance is their way to benefit from essential services? Is it conflict? Is it discrimination? Is it poverty? Is it social exclusion, or is it remoteness? So as we discuss integration, also I encourage all of you to look at already the several entry points that we have and make the best use out of them. In our region, we convened at the end of last year an Arab Social Protection Ministerial Conference, which resulted in a declaration which explicitly calls for improving national social protection coordination arrangements and promoting integrated social protection responses, strengthening linkages between social protection and other sectors such as health, education, and employment, and including through referrals and case management. In MENA, UNICEF has also adopted 2 areas where we would like to see an acceleration of results. One is on social protection and the other one on violence against children. So it's a useful framework for acceleration of of results within particular milestones and along a set of indicators. And it's a useful framework actually to guide our country offices as they explore ways to accelerate results in these two areas. I would say also as another entry point, and we will see it in the webinar today, we have in a few of our countries very solid evidence on what constitutes vulnerabilities. So we have to see how we share such evidence across different sectors and services for better targeting and harmonizing services delivered to vulnerable families. And I think today we'll hear from the case of Egypt, especially on how their protection vulnerability index developed by the Ministry of Social Solidarity serves actually to classify the vulnerability level among different households and prioritize the most vulnerable households to receive visits from social workers. And a few countries in our region have already developed also their social services workforce. That's another entry point. I mean, Tunisia, Morocco, and Algeria, for instance. So clarifying the mandate, the purpose, the protocols which govern the social protection, social services work, as well as investing in the skills for social workers for better support to family is actually needed. So in conclusion, I would say that we're holding this webinar today to really reflect on concrete pathways which would lead us to better integration of social protection approaches and the link with child protection, especially with a focus on linkages between cash transfers, social welfare, and specific services. So we're looking forward very much to hearing from you about what works, about the challenges you face. And by the end of the webinar, I would be personally very interested in hearing recommendations on how we can accelerate results in this integration that we are aiming at. Thank you very much, and back to you, Charlotte.
Excellent. Thank you, Bertrand. Thank you very much for your opening remarks and for setting the scene for this webinar and providing a bit of framework as well from UNICEF's perspective. And great also that you highlighted some of the already existing entry points in the region, such as the data collection in Egypt or other efforts in terms of strengthening the social service workforce. I would now like to hand over to our first presenter, Tomoo. Tomoo from UNICEF headquarters. Please, the floor is yours for 10 minutes. Thank you.
Thank you, Charlotte. Hi, hello everybody who's watching here on live or watching the recording. My name is Tomoo Okubo. I'm the policy specialist on social protection at UNICEF New York headquarters, and I will be making a 10 minutes brief presentation on this two sectors collaboration building on Bernard's excellent scene setting. On behalf of both the social protection team and the child protection team in New York. I'm just, before I start and share the screen, I'm just taking a moment to really congratulate and welcome more than 130 participants in the webinar, which I'm really, really pleased to see the numbers. So congratulations to UNICEF MENA colleagues and IPC-IG as a partner who brought up this topic, worked in collaboration with country offices and partners to unpack this really important issue for children and to bring this into a report in the webinar. And welcome to 130 colleagues, and I heard almost 400 people have registered who can have access later on. And it's really important. It makes a lot of importance for me that colleagues are coming. I see a lot of names from UNICEF, a lot of partners from partners of the FP, I saw World Bank, and then civil society colleagues from government who really wants to understand and discuss how can we link child protection and social protection together for child outcome. My personal background, actually, I was working on child protection. I was a social service worker in Mozambique, primarily on child protection issues. Then I moved on to doing more of a social protection work on cash transfers and linking systems. And personally, I've always felt we really need to get both to reach the most marginalized. You cannot address children or a child or families who are facing multidimensional risk, vulnerabilities, really difficult situations without addressing the economic bottlenecks through social protection. And social protection is so important to address the economic and social vulnerabilities, but that's not going to solve all the other risks and vulnerabilities that the most difficult deprived children and families are facing. So personally, in my 10 years career, I've been thinking, how can we bring these together? Exactly for those families and children who need comprehensive support and who will benefit and will be able to live to their full potential if these services and providers and sectors coming together. And this webinar, through the presentations and the report, it's so encouraging to see that it's not an easy topic. The two sectors, the two professionals, or maybe other sectors are coming together with different tools, different knowledge. So if we can leverage them together, we will be able to reach better. But there isn't, it's not an easy, straightforward process. So we'll learn a lot from countries and their reports, how this has been done and what can we take away. And I'm so sure that those who joined, it's now increasing to 140 colleagues, will take the lessons and will reflect into the daily practice so that we can reach families and children better with knowledge and toolkit. So I'm really pleased to, again, see this initiative and all the colleagues coming in. Thank you so much, colleagues in the chat, for agreeing and echoing. I'm sure you have similar sentiments. I'm just going to run through in my remaining 6-7 minutes just how important it is on the collaboration and what are maybe some of the angles that we can look at the case studies together throughout this webinar today. So again, I will be speaking very broadly from macro sense from headquarters and the both social protection and child protection team. How can we achieve the impacts better together? And one thread, one topic that will run through this webinar is collaboration. It's going to be a collaboration between professionals, between sectors, ministries, agencies who really want to tackle the poverty and economic social vulnerability on one hand, and then also to prevent violence, neglect, harmful practices against children. And in some cases, those you're watching, you're working on both of them. On some cases, you're maybe primarily focusing on one of the areas. In some cases, you might be supervising the coordination of two sectors. But at the end, it is a collaborative initiative or collaborative work that brings these two together. And one question I always have on collaboration is what makes a collaboration real? Collaboration is not a new word, it's not a new concept. Everybody in development and policy making will talk about multi-sectoral plans. How do we do these coordination groups? How can we have joint funds, joint programs together? SDGs number 17 is on partnerships. But what I also have seen myself personally, and I think many of you have seen this, some collaborations end up superficially. That we say in the reports or we say in our occasion that this was this collaboration between it. Some collaboration really is able to bring together a joint result that changes the lives of children and families. And what I'm really keen to understand from this webinar and what will be shared will be how did colleagues, how did different departments with partners work together to make this collaboration real on child protection and social protection. So 3 elements that I wanted to flag, and then it will be more kind of delved into each case study, which will be on the trust in relationships, as we are all people, human beings trying to bring it together. Without this foundation, it will be very difficult to move forward. And then finding synergies between the two systems, just to say, it doesn't mean that we all have to collaborate on everything. That's impossible. It's about finding where are the best synergies between the two sectors and how can we find the synergy. And last but not least, how can we make that trust and synergy into something that transforms the policies and programs to transform the lives of children and family at the end. So on the trust and relationship, one thing that would be really important to recognize is in many cases, there will be different professionals, expertise, knowledge in each sector on social protection and child protection. And there might be different values, terminologies, looking at how to systems beyond the programs. Like, what are the policy? What do you mean by systems on social protection and child protection? How to flesh out or to discuss how each sectors complement each other. What are the systems that we're talking about, and what ultimate goals that colleagues around the table are sharing to make this collaboration meaningful. And one of the key important goals that was already highlighted by Bertrand was the fact that children and families are facing multidimensional risk and poverty. So if that's the ultimate goal, and we have several sectors or departments working on this goal, how can each complement and work together? Having these discussions and understanding between the two sectors will be very important to build that trust and relationship. And once we have a little bit more foundational trust and relationship to tackle the problem, then there could be a lot of entry points. And I wouldn't get into details because these will be presented in the report and the coming presentations from countries, but it can be multiple options or entry points depending on the country context, including on assessments of the situation of children and poverty vulnerability. How do we strengthen social service workforce together? How to link services and programs? How do we use case management and their databases together? Or what can we do to have evidence generation, monitoring, and evaluation together? And just to highlight, I won't go into detail, but on UNICEF social strategic plan that starts this year until 2025, where the two goal areas on child protection and child poverty social protection are identified, as well as accompanying UNICEF framework on social protection and child protection, we do have key synergies and entry points that are brought up from system perspective. So these resources would be shared and could be an entry point to the discussion. And last slide for me is how do we make sure that these collaborations and synergies are actually transforming policies and programs at various levels, including how do we support expanding the social service workforce so that they're not overburdened, but they can actually perform the jobs of connecting the services and programs together. What are the coordination mechanisms between the two? Is there other sectors actually outside of the two, on health, on schools, on other services that can actually help bringing more comprehensive services? What are the national and subnational level engagement that we need to look at? And then how are these last points coming together from the viewpoint of children and families so that it can actually achieve the impact? So that was a quick overview from my end. I'm really excited to hear from actual country examples and the research team on the project on what they found on the collaboration from the region. Thank you very much.
Thank you, Tomoo. Thank you very much for this really excellent presentation and yeah, your thoughts and overview in terms of what it really takes for meaningful collaboration between the two areas. I would now like to hand over to my colleagues, Fabio and Karen, for the presentation of the study. So I think first over to Fabio. Please, the floor is yours for 10 minutes.
Yes, thank you, Charlotte. 10 minutes for me and for Karen, right? Yes,
yes,
so
for both
I only
of you
have 5 minutes. It's good because the precedent speakers also touch up on at least one of the slides that I'm going to present, so I can skip over it and add other things. So, so basically the topic of this webinar is to discuss why and how it's important to integrate social protection and child protection through social service workforce. Next slide, Karen, please. Okay, so the context is actually a project that has already been mentioned between the IPC-IG and UNICEF MENARO, with the collaboration of 4 country offices, for which we want to thank all the social protection and the child protection focal points that have supported our team in writing up the report that's going to be published soon, that focus on the case studies on Egypt, Morocco, Tunisia, Iraq, and we added from the IPC-IG side and from the IPEA side, the Brazilian case. So next slide, Karen. So why is that important? So I think that my colleagues gave the context before. So we have the whole issue that children in the MENA region, not only in the MENA region, but particularly in the MENA region, are vulnerable to the context. So they're particularly affected by the conflict and high poverty levels. And by poverty here, we mean both monetary poverty and also multidimensional poverty, as has already been mentioned. One aspect that's important, particularly when we talk about the child protection, is the issue of violence against children, and particularly violence against children within the households. And that's a particular aspect where other social protection instruments are not very effective in dealing with it, in which it's a clear example where we do need to have child protection and social workers supporting families to address the issue. So taking this as an example, it's very important to have integrated social protection systems so that we can bring together social protection and child protection. If we look, for example, at the effort that has been done by the SPIAC-B, the Social Protection Interagency Cooperation Board, and we look at one of the instruments that have been developed to support countries in identifying and making inventory of the social protection programs that they implement, we see that social service care is one of the components of the social protection system. So traditionally, when we talk about social protection, we think about social assistance, we think in social assistance as non-contributory transfers, we think about social security, and we think about active labor market policies. But social care service is also a very important dimension. And within the social care service, we do need to have well-trained and well-prepared social service workers. So social workers are key to implement one of the components of the social protection system. And within these components, the social care service, we do have a very important issue to address, that's child protection. So that's how I think that social protection and social care service and child protection are connected. In fact, they are part of the same system, and the challenge that we have and that we're going to learn from the country's experience is basically how to integrate these different subcomponents of this system in a better way so that we can achieve better results. And to do that, it's key to have good social service workers. So good social workers, and why? Because they're on the front line, so providing social welfare service to those directly in need, managing social welfare structures, so the centers that receive the families, the centers that are prepared to reach out to the families, and also conceptualizing, designing, and planning social welfare policies and programs that could be integrated to cash transfers and to other social protection interventions. And also they have a very important role in terms of advocacy. Next slide, Karen. So what are the benefits of integrating social protection and child protection? So here we can think first on what we come first to our minds when you talk about social protection. So we see that we are expanding cash transfers all over the world, and in the MENA region we have several examples. So those who haven't done it yet are planning to do it. And here is a great opportunity to get more information and to reach out to the families. And to do that, it's very important that the social workforce is prepared to be linked with this type of intervention, understand this type of intervention, support this type of intervention, but also are able to develop their own specific work in supporting families and particular children in the case that we are discussing. The other very important aspect is that when we think about cash transfers, we have many constraints that does not allow the cash transfer to have its full impact. And many of these constraints can be addressed by the work that's done by the social workers through counseling, for social behavior communication change that they can support to implement, and other types of measures. So that could actually support social protection and improve and increase the impact, the positive impact that social protection can have. And finally, there is the issue that resources can be put together so that it would be easier to avoid duplication and actually get these better results that I was talking about with not having to invest too much in both systems. So over to you, Karen, to talk a little more about ways to integrate based on the review that we have done. Thank you.
Thank you, Fabio. Good morning and good afternoon for everyone, wherever you are. First of all, I wanted to thank you everyone for the presence here in the webinar today, and for the speakers and the socialprotection.org team that helped us to organize this webinar. And also thank you for all the speakers that have already spoke and presented a broad light for the importance of integrating social protection and child protection. So I'm Karen Pereira. I'm a researcher at the International Policy Center for Inclusive Growth and one of the authors of the developed report on the same subject of the webinar. So as Fabio just presented, the main benefits of implementing integrated social protection and child protection services. So I will look now more on some recommendations on how this integration can be developed or strengthened, with a special focus on measures for the social services workforce. Those recommendations were developed based on the case studies presented in the report. As they've already mentioned, we looked for the example of Egypt, Tunisia, Morocco, Iraq, and Brazil. So the first recommendation, the first measure is to promote setting shared goals and joint planning between social protection and child protection ministry or agencies responsible for those services. In some contexts, promoting joint planning between different government levels as well. For example, a federal level with more regional and local levels responsible for implementing the social protection services. This communication between the responsible actors allows the exchange of information, improving the understanding of the children and families' needs, besides being able to benefit from synergy between social protection and child protection services, since they have many shared goals. And as we've seen, as Fabio told, that many of the issues faced by families and especially children need a more comprehensive services. So integrating the agencies responsible for those services can bring more integrated services. So for instance, in the case of Tunisia, the integration between the ministries responsible for social protection and child protection allow a broader coverage for the social protection schemes, despite the limited resource that they face, especially the Child Protection Agency in Tunisia. So another measure is to develop case management and guidelines with a procedure on how to link child protection and social protection by referring cases and relevant agencies or services providers, as it seems in the case of the Child and Adolescents Institute in Brazil, as Rafael is going to present in more details in his presentation. But you have that all agencies that act in the child protection systems, they can trigger the social protection services for children in Brazil in cases where they found violation of rights for children. Another way of integrating social protection, child protection, is by developing an integrated database with information about social protection and child protection aspects to identify and monitor families in need of those services. Besides this integrated database, besides helping to monitor family, it's an important tool to prioritize and analyze eligibility for receive benefits or specific social protection services. By doing so, the social services workforce can focus the resource of social protection on the most needed families, and especially families with vulnerable children. For example, Egypt is currently developing a vulnerability index based on data about violence on children to be used as a tool to select and prioritize cash transfers beneficiaries to receive social workers visited in Egypt. Another measure to promote integration between social protection and child protection is to strengthen education and training about child protection for all social services workforce, and hire experienced and educated social services workforce, since they play an essential role providing and planning social protection services, as Fabio have put it. Besides that, designing programs and services integrating social protection, child protection objectives, providing a holistic view of the social protection to family and children, for instance, with cash plus programs, with child protection components. It's another measure to integrate both services and have a more comprehensive social protection for children. Furthermore, develop unified social protection systems that integrate in the same planning and monitoring system should be a key goal for social protection systems in the world. This will help to improve efficiency and better address the complex needs of children and families. As we are going to see, the Brazilian case is a good example of a unified social protection system and child protection, as Rafael is going to detail. Brazil have developed a framework that combine child protection and social protection in a very unique way. So these are the main message and main recommendations that we found based on the case studies analyzing the report. And if you want to have more information and more details about it, we are discussing here, you can see in the report and the one pager that we are gonna launch soon in the IPC-IG website. So thank you, and I will head over to Charlotte again. Thank you.
Thank you, Karin, and thank you, Fabio. Great. I think we're all looking forward to the launch of the report, which will also provide more information on the different case studies. Great. So I actually, before handing over to Karima, I want to remind everyone that you can send in your questions also through the Q&A function at the bottom of your screen, and then we can take them to the Q&A session after the presentations. So Karima, please, you have the floor for 15 minutes. Thank you again for being with us today. It's great to be hearing from Morocco. Please, the floor is yours, Karima.
Thank you. Thank you, dear Charlotte, for introducing, and a very warm welcome to all participants in this webinar, for joining us and for your interest. Thanks also to UNICEF colleagues for this great initiative for this study, highlighting the importance of integration between social protection, child protection through social work. Thanks also to IPC colleagues for implementing this study and giving us this overview of the results. Really, I'm personally very interested and look forward to more details for the other MENA country case studies. And for my part, I'm very glad to participate to this webinar and to share on behalf of child protection and social protection teams here in Morocco, to share the case study of Morocco. And I believe this case study showcases more a strategic opportunity to combine and integrate child protection, local system, and social protection reform, particularly family allowances, to advance outcomes for children. So in the next 15 minutes, I will be presenting very briefly the global context of child poverty and vulnerability in Morocco and related institutional responses. And then I will after share with you the key building blocks of the child protection local systems and introduce the upcoming family allowances scheme. And then I will go through what are the current opportunities for integrated approach before concluding with the perspectives. So I will share now my presentation. Just want, is it okay? You see the presentation?
Yes, it's great.
Oh, great, because I didn't see it. Yes. So in terms of context of poverty and vulnerability in Morocco, Morocco is considered a low middle income country. And despite social advances in recent years, child poverty is still a concern in Morocco, as you see in the graph, and especially in rural areas. And more importantly, after the COVID impact, we have done a study to see the impact of COVID on child poverty, and it highlighted really a high increase of child poverty, hijacking more than a decade of Morocco progress in reducing poverty. And also beyond monetary poverty, a multidimensional poverty study also done in 2015 showed that around 40% of children in Morocco are living with 2 or more deprivations related to housing, water, sanitation, nutrition, health, medical coverage, education, and information, with a rise to 70% in rural areas. Unfortunately, we didn't succeed in including also VAC indicators in household surveys, but we will do it next year since we are launching also mixed study in Morocco. And in terms of key institutional responses to tackle child poverty and vulnerability, with regard to child protection, UNICEF worked closely with the Ministry of Solidarity, of Social Inclusion and Family to develop an integrated policy for the protection of children, and it is now still being implemented. It consists of national efforts to standardize and integrate the different child protection actions and programs at central, but more importantly at local levels. And also in 2020, Morocco adopted a social workers law, which implementation is still on progress. With regard to social protection schemes for children, since 2008, Morocco started 2 important social assistance programs to reduce poverty and vulnerability. We have the RAMED, the social assistance medical health insurance, and the Taysir, a social cash transfer for children with schooling condition. And in 2019, the government validated an integrated social protection public policy for which UNICEF and, by the way, also IPC provided technical support. And this policy aimed to achieve minimum social protection floor based on a life cycle approach. And then in 2020, the COVID increased the authority awareness of the importance of social protection. So a year after, Morocco adopted an ambitious national framework law on social protection, which gives real impetus to universal health coverage by 2022 and universal family allowances by 2024. So if you want to summarize, now, these 3 key reforms, including also the launch of a national social registry, offers really a golden opportunity for integration, especially through the cornerstone of social work, to help to tackle the challenges of multidimensional poverty faced by children and to improve more efficiently children's socioeconomic and well-being outcomes. And also good to know that these 3 key reforms are implemented all with an important budget government support from EU, which is also an excellent point for better integration and coordination. With regards to child protection, I will only share with you the main building blocks of the system of child protection. And if you want participants who would like really more details, I invite you to visit our website to download more resources. The child protection integrated policy introduced in Morocco a standardized public local child protection mechanism and services. And namely, it is about enhancing governance and accountability with institutional, central and local coordination committee, and of course, standardized norms in terms of social work, case management tool. There are still some missing pieces not yet implemented in the field, but the policy is comprehensive and robust, and it has been implemented up to now in 17 provinces out of 75. But more importantly, the mechanisms include Provincial Child Protection Support Center, what we call Centre d'accompagnement de la protection de l'enfance, which are local social workers units and gateways to benefit from child protection services. And the approach focuses on services continuity. So it promotes the orientation of children and families towards existing public services and programs, including, of course, social protection available schemes, but not only, of course, judicial services, health, education, disability services, etc. And another entry point in the social protection local systems is also related to information management system and data on children vulnerability. And I will talk about it later in other slides. With regards to the social protection schemes for children, in the last 5 years, Morocco social protection reform has been reformed to build a more inclusive and more efficient system. And with regard to children, the coverage and adequacy of benefits, according to the latest administrative data in 2021, as you see in the chart, children not covered by any child benefit scheme represent approximately 42% of total children. And in addition, the Taysir schooling program, social conditional cash transfer, which represent nearly 22% of children's coverage, are not enough adequate if we compare them to the average expenditure of a Moroccan family. And the recent reform, with the buy-in from the highest authorities of Morocco, aims to cover all children by 2024 through the extension of the family allowances actual contributive scheme. And UNICEF is working closely with the Ministry of Finance for the costing and the fiscal space analysis of this extension, taking into consideration not only the impact of COVID, but also the more recent impact of a severe drought and rising prices following the Ukraine war. We need also to keep in mind that Morocco has also issued a national unified social registry, including economic targeting, which is based on Proxime's testing formula for eligibility to non-contributive schemes. And this is important to note. This first means that the Morocco family allowances are more like a quasi-universal scheme. And this point is very important to keep in mind with regard to the integration between social protection and child protection. And concerning the current opportunities for integration between child protection and social protection through the social service workforce, in Morocco, we believe there are 3 key opportunities related to case management, to social work capacities, and also to information management system. Indeed, as I mentioned before, the developed and ongoing scaling of case management includes guidelines with procedures on how to link and refer cases to multi-sectoral relevant agency or services providers, and it is an important measure that will allow to integrate social protection and child protection scheme. And the aim here is also to increase preventive child protection interventions by early referring families and supporting them to register in the social protection schemes to reduce the risk of falling in poverty. And as I mentioned, to provide child protection social service workforce with the skills, a capacity building program was developed, and there is continuing investment on developing these training modules for social protection, social workforce, and this will help also to build the capacity rapidly of the social workforce of the family allowances program, and to build networking also between the social workers. And in addition, having skilled and trained child protection social workers will constitute a pool of national and local trainers that we can easily mobilize for the extension and for the implementation of the social program, the family allowances program. And also, as I mentioned earlier, the Provincial Child Protection Support Center as initial gateways are also responsible for creating and for managing databases on the situation of the children at the provincial level, transmitting this information to national systems for aggregation and more analysis, including all the services that are offered. And this process now has been digitalized and is actually piloted. So the Child Protection Information Management System and its databases will be of great use to analyze child vulnerability at local and national levels and to strengthen outreach and social inclusion within family allowances scheme. How? By facilitating the identification of vulnerable children that are not covered by social protection schemes. And there is also an opportunity for IMS, for Information Management System interconnection, for a more proactive, inclusive targeting for social protection schemes. So now with regards to the perspectives and the way forward to move towards better integration and synergy, first, as UNICEF Morocco, we are planning to focus on the combination of social work approach in the upcoming family allowances, because to ensure inclusive and right-based registration, outreach and complaint process of the family allowances, there is a need for social work and case management approaches within the family allowances processes. Why? In order to contribute to early detection of exclusion error, to allow for them to be proactively corrected and addressed. And this is really key for social cohesion and citizens' trust in a newly started social protection scheme. And more particularly in a country such as Morocco, with a large informal sector and the predominant transitory poverty dynamic, relying only on a social registries PMT targeting, mechanisms could for sure imply leaving behind a large portion of the most vulnerable population, especially the missing middle classes. And in addition, in Morocco, if the schooling conditionalities are to be maintained also for the upcoming family allowances, social workforce follow-up of children and households that are not eligible due to schooling dropout is to be used as a trigger for more support, either through social protection, social workers, or through referral to child protection for the visits of the family and the support to the family. Second perspective for us as UNICEF Morocco in the coming country program, we plan to promote and also to accelerate fundraising to develop Cash Plus pilots, because we believe that it is very important for the integration between child protection and social protection. And we believe also that if to be launched, inshallah, a future Cash Plus in Morocco should also integrate with child protection through social work. And why? Why do we need necessarily to have social work and child protection? Because while different Cash Plus programs take different forms depending on the context, a crucial component of successful approaches is trained social workers who will understand holistic family and children needs and provide either direct support or access to other programs. And as social workforce remains still weak in Morocco, the family allowances scheme with larger scopes, with larger means, and with larger buy-in from highest authority is an excellent opportunity for leveraging investment in social workforce. And we also believe that our Cash Plus have to be very progressive by progressive, we mean that starting with sharing information about eligibility, about criteria, procedures, and progressively enlarging the integration scope towards sharing administrative processes, sharing social worker staffs, before ultimately implementing single windows registries. And last but not least, we also trust that we need to continue to contribute to further governance and coordination strengthening to move forward a sustainable integrated approach. We are confident of Morocco's future progress toward integrated governance, not only because the maturity of these recent child protection and social protection policies and laws will allow gradually for more trust between actors and thus for more willingness to share risks and to share results. We are also confident because with the new development model of Morocco and also the social protection framework law, there is a vision of a unified social assistance structure for Morocco. In addition, Morocco new development models require to engage towards stronger decentralization. And this is an opportunity for integrated approach, since subsidiarity is a key success factor for stronger local coordinated and integrated approach. So to conclude, our hope is to have a progressive and sustainable integration of social protection and child protection in the same planning and monitoring system to really effectively contribute to a breakthrough in efficiency and better address the complex needs of the vulnerable children and families in Morocco. Thanks a lot for your interest and attention, and I really am much looking to more discussion through the Q&As. Thank you.
Perfect. Thank you very much, Karima. I think this was a really interesting and comprehensive presentation. You highlighted some of the ongoing efforts in Morocco to achieve integration between the two areas. I think that was really interesting, and I see a lot of comments coming in on the chat and also some questions already in the Q&A box. So thank you very much. That was really interesting. I would now like to hand over to our second case study, which will be presented by Rafael Osorio. Rafael, you have the floor for 15 minutes, please.
Thank you, Charlotte. Good morning to those of you who are in the Americas. Good afternoon for those of you who are quite literally ahead of my time. I'm going to start sharing my screen here. So today I will be presenting about the Brazilian case, which is a case where we have a full integration between child protection and social protection. First, I would like to thank Fernando, who couldn't be with us today, but has put a lot of effort in this project, and Karen for helping me to organize the presentation. You did a great job, guys. Thank you. So I'll start presenting to you the legal framework for the integration of social protection and child protection. We know that it's very important for us to have a comprehensive framework. So in Brazil, it all starts with the Constitution, the 1988 Constitution. As it's written here, the state has the duty to provide access, to guarantee the access to child health, child rights. And there is a particular article in our Constitution that is quoted here that says that this is not the duty of the state. This is not just the whole of the state, it's also the whole of families and society as a whole, so to guarantee children, adolescents, and young people's rights. What is missing here in the quotes where we have the dots, the part that was omitted is actually very important. It says that this should be done with absolute priority. So it means that if the state has to make an option between guaranteeing child's rights and doing other things, it should prioritize child's rights. So you know, nothing that is in the Constitution, everything that is in the Constitution requires a law to further detail how these constitutional provisions should be addressed. So we have this Child and Adolescent Act, which is called the Estatuto da Criança e do Adolescente in Portuguese, who provides the legal framework for how these rights are going to be guaranteed. And then just a little bit later, we had the law of social assistance, which is the organic law. We call it organic law, but it's like a constitution for social assistance. So everything has to be under this broader law. And by the end of the 1990s, we got the first standard operational procedures for social assistance. And by that time, we were trying to integrate the various levels because, you know, Brazil has a federative system with different levels of government. Social assistance in Brazil is decentralized, and at every level of the federation, every entity has its own responsibilities, like municipalities, the provinces, and the federal government all have their very well-established roles on what they should be doing, what they should be funding, and what are the services. A little bit later, we had the creation of the single registry for targeted social programs, but it's very important to mention that social protection and child protection in Brazil are not targeted. They are universal. They are meant for everyone, really. Then in 2004, we had the first national social assistance policy, which is a document that provides the guidelines on how the social assistance should be provided. It goes beyond the organic law of social assistance in the sense that it provides guidelines to the actual work of social workers. So, for instance, a very important principle in this national policy is that people should feel welcomed in the services, meaning that whenever someone goes to a service seeking social assistance, this person has to be well received and welcomed, so that the social work can establish a link of trust, and people can be develop confidence that they are going to have their needs addressed by the social workers in the center that they seek for. So later we'd had another normative instruction where the whole system was further developed. And then we had other resolutions that go and include new regulations, new measures for the provisions of services. One that is very important is regarding training. So we're going to be talking a little bit about how the social workforce is trained in Brazil. So we had this Child and Adolescent Statute or Act that established all the institutions that are going to offer child protection. It's called the Rights Guarantee Systems. It's not just for children. It's for other groups as well, like persons with disabilities, the elder, women. So there are specific provisions in the right guarantee systems for different groups. So they have these activities divided in those three axes because different entities do different things. Like the attendance is more like the welcoming part of providing services, actually the defense and control. So all these actors, they can trigger the social protection system whenever they detect that a child's rights are being violated, or not only violated, they are subjected to the risk of being violated. So it's preventive, it's not just responding to situations. And the first entities that are very important, they are established by the Child and Adolescent Statute, the national, state, and municipal councils for the rights of children and adolescents. This is very important. We have more than 5,000 municipalities in Brazil, and every municipality should have a municipal council that takes care of the rights of children and adolescents. The people that are a part of this council, they represent all the institutions that are part of the system, but also civil society organizations and government and civil society. So we have the public prosecutor's office. They also can actually they do a lot of they do a lot of demands to the system. Like for instance, if they find out that a school has some type of problem with the treatment of children and things like that, so they can trigger the system so that the social workers will go to verify the situation. You have the public defender's office that also do this role. There are some overlapping between the different institutions, but this should not be seen as something necessarily negative. It means that there are lots of people watching whether the child rights are being really guaranteed. There are the guardianship councils. These are very interesting because they are not the municipal councils for the rights. They are bodies of people that are elected. They have a mandate, 4 years, if I'm not wrong. And these people have the role of receiving denounces of situations of child rights violation. Like if your neighbor is beating his child, you can go to the guardian councilship and say, look, in the house, my neighbor beats his children. And then they will trigger the social assistance system to have the social workers go there and visit that family and assess the situation. In the most serious cases, they can even take the child out of the family and place it with a foster family. We have the public securities like the police and etc. And we have these special defense centers for the rights of the children and adolescents. These are not established in the whole country, just in a few municipalities. So in Brazil, we have this unified system of social assistance. That is where child protection happens. It's important to mention that they do more like the actual functioning, the operations of the system, but not all of the institutions that are part of the child protection are part of the SUAS, the social assistance system, but they work together. They participate and they have this decentralized model. So as I said, they define the criteria, they define how it should be done and things like that. I'm losing track of time here. Okay. So yes, so we have this decentralized system with different roles for the different levels of government. Okay, so how work is done at SUAS? So the social workers, they are not actually the social workers are subject to performance evaluation, but the system as a whole in the municipalities. So we have this IGD, which is it's an index of the quality of the administration. We started with one for Bolsa Família, but the actual one for Bolsa Família is actually for the single registry. So municipalities that do a good work in enrolling families in the single registry and keeping their records updated, they receive an amount from the federal government. This is a fund-to-fund transference. So you have a national fund for social assistance at the federal level. You have a state fund for social assistance, and you have a municipal fund for social assistance. So if the municipality is doing well in performing performing X activities related to the single registry, it receives a transference to the municipal fund that can be used to further improve the social assistance activities. But later, people thought that it would be a good idea if this was applied to services as well. So you have the same scheme, but not related to the single registry, but to the provision of services overall. And then municipalities that are performing well according to certain criteria, very objective actually, in providing the services, they also receive more funds from the federal government to do these activities, to perform these activities. Social workers are public civil servants. This is very important to mention. In Brazil, they are selected by, it's a public selection. They have to go through this competitive recruitment process. They have very clear rules that establish about their career plans, their salaries, and etc. So actually, is a very good occupation at the municipal level, particularly in small municipalities. So the social assistance, this is very interesting for our audience. This is something that people usually don't think, but social assistance generates jobs, and actually in Brazil, good quality jobs. And interesting, they are a channel of upward mobility to many, as this profession of social worker is a very feminine, is pursued mostly by women, is a very important channel of upward mobility for women that come from poor backgrounds. They go to if they manage to enter the university and graduate in social, as a social worker, there is a very good niche in the labor market waiting for them. So social workers in Brazil are a professional category. You have like a middle level, mid education, secondary education social workers that perform the lower complexity jobs. But to be like a full-fledged social worker, to actually do work with the families, you have to be a social worker, graduated as a social worker, as a psychologist, a lawyer, a pedagogue, a sociologist, or anthropologist. But these professionals, they have different roles. So the social worker works like the person that welcomes the people that come seeking for services, and will do the referrals to the other professionals on a need basis. Everything has is participatory. So the social assistance system, you have for the child protection system, you have the municipal councils, you have the guardian councilships, but you also have the national councils for social assistance, the state council for social assistance, the municipal council for social assistance. And sometimes, you know, people that participate in the child council, they also might be participating in the social assistance councils. And there are these mechanisms, these bodies where people, you know, the managers and the practitioners of social assistance in the different level of government, they sit together to discuss the issues and eventually to issue new regulations, new standard operational procedures so that they can deal with new emerging situations, social change, and new problems that come out with the change of times. So training is very important. So the idea is that all those professionals that work providing social assistance in the system of unified social assistance, they must be continuously capacitated. They should have capacity building, should be a continuous activity. So there are all those disadvantages that these are advantages. There are these items that are here, but the idea is that people should be continually trained so they can develop their skills to better provide the services that they should be providing. There's this knowledge, ability, and attitude, and this is actually the attitude part is the most difficult one, because actually you need nice people to. Social workers should be educated, should be calm, should be welcoming, and sometimes, you know, the human nature does not help with all of that, but people try to, you know, in these trainings to develop these skills to better serve the population. So there is a school and a whole training system. So there are courses that are pre-established that people can actually seek to work. And the idea is that every social center, be it at the basic level, which is the Center for Reference in Social Assistance, the CRAS, or the specialized systems that provide services to more complicated situations, people that work in these systems, all types of workers should go through this training and education courses, like whenever they have the chance. So there are some data here on how this works. So this is from 2019. I saw some questions in the Q&A box about databases and how the data is collected. So in Brazil, all this system, we have a census. It's called the SUAS census. Every year, a form is all the center. The CRAS is the basic assistance center, and the CREAS is the specialized center. Medium complexity services and high complexity services, like most of the services that are provided for child protection, are considered medium complexity and high complexity. So if a family has to be placed in a if a child has to be placed in a foster family, this is considered a high complexity service, because of course it's not an easy situation. So, but these services, these high complexity services, they are not present in all the municipalities, but the basic services are. So sometimes what we have is that people that are working in the basic services, they have somehow to provide these medium and high complexity services because those are not available in the municipality. So this is something that the system is still lacking, the further development of the capacity to provide these more specialized services, like for children that are victims of violence, children that lost their families somehow, and these more complicated situations. So we have more than 8,000 centers for basic social protection, the basic social centers, and all the professional. This is their workforce is more than 110,000 professionals, about that. And then in the specialized centers, you have less professionals. So this data is for 2019, but we have the data for previous years as well. We didn't want to put out a lot of data here, and we put data before the COVID crisis. So, because of course, during the COVID crisis, the services were kind of disrupted. The services were open actually, but people were not seeking the services. And then we have the numbers of the centers that did some kind of capacity building for their workforce. So you see that in the year 2019, 28% of the basic centers had their social workforce going through some kind of capacity building course or action, a workshop. It can be a workshop. It can be, there are many different forms where this capacity building can be done. So if you compare the total of professionals that participated in some course, is not that large comparing to the total of professionals, but you know, it's like there are some capacity actions that are some courses that you do only once, you don't do twice. So I mean, if we add up with the people that have been trained on the previous years, you could say that almost all professionals that are working in the system of unified social assistance, they have gone through some training, not counting the one that have gone through university training. That because as I said, I mean, to be a social worker in Brazil, you do. My time is up. I see Charlotte here. Yeah. Okay. So on the side, we had the composition, the educational profile of the workforce, and also by professional formation. So you see that social workers are like 20% of the workforce, and you have the psychologists. But it's important to mention that when it comes to the high complexity services, the medium complexity services, like the more specialized services that will attend children that are victims of violence, or children that are not being sent to school by their parents or something like that, those are going to be taken by psychologists and by social workers. So it's highly specialized people that are taking care of these services. That's all. Thank you. I hope we'll have more time for the Q&A later, and we can continue this interaction. And if not possible in this section, you can also email me, then I'll have the pleasure to answer your questions if I'm able to, of course. Thank you. Charlotte, over to you.
Thank you, Rafael. Thanks. Yeah, I was informed that we can go a little bit over time, so that we can take at least some questions in. I can see that actually colleagues have already started responding to most of the questions, and I'm afraid we won't have time to go through all of them. But if I may, I would maybe like to ask Karima, because I saw you were already very active also in responding and writing. Karima, maybe you want to just very briefly, in 1 or 2 minutes max, refer to the questions that was in the Q&A box regarding actually the referral from child protection to social protection services rather than the other way around, which is usually the case. So maybe you can reflect on that from your experience in Morocco, and then also, if you can, on the issue of privacy and data protection of sensitive data. Thank you, Karima. Over to you.
Yes. Okay. So for the question for Morocco, it was it was just that in Morocco, the first to be launched are the child protection integrated system. That's why we started the referral from the child protection. But it is true that usually, since the social protection schemes have a higher scope, it usually begins from the social protection schemes, but in Morocco it started from the child protection. So, and it works well in the piloted provinces. And then the other question was related to data privacy and the problem of sharing information about data vulnerability, especially between from child protection databases. In Morocco, we have also a national law regulating data protection and data privacy, and that helps a lot, because you have already the law. So when you are issuing protocols, when you are issuing code of conducts for social workers that need to be signed in order to engage them in data privacy, you have already a law that is enforcing this protection. So in countries where such law does not exist, the focus will need to be done on the protocols, on the code of conducts that need to be signed by the social workers in terms of confidentiality. But also there are efforts, of course, to do in terms of anonymization of the data, IT efforts. And here I think that MENARO, the information management system for child protection developed by UNICEF, offers also a good example, a good benchmark with regard to protocols that need to be signed and with regard to processes related to data protection. Thanks. Do you have any other questions?
Thank you, Karima. No, great. Thank you. Maybe the next question
I stay available.
Thank you. I would like to address to Karin. There was a question in the Q&A box on some of the important challenges in setting up referral and case management mechanisms, which I think is, of course, a key topic in this webinar. So if you want, Karin, maybe reflecting and based on your study and the case studies we reviewed, if you can reflect on some of the main challenges for case management and how countries can address those. And kindly try to be brief. Thank you, Karin.
Yeah, I'll be very quick. So I think one of the main challenge of implemented case management and is incorporating local complexities, and it's important to know local services and the supply of every regions in order to apply those case management. So one way to overcome this challenge, I think, is having a trained and educated social services workforce, since they are the ones that implement the case management, and they can then adapt case management for these specific situations and those specific challenges in each region and locally. So yeah, I think that's it. I don't know if Karima wants to complement my answer. She's also answered that in the Q&A.
Yes, just sorry. I was just writing a chart. Could you remind me of the question?
Sure. The question is about important challenge of setting up a refer or case management mechanism in countries.
With regard to provinces?
Actually, the question is, what do you think about some important challenges and setting up a referral and case management mechanism, which includes, among others, the capacity of services supply to respond effectively to the demand side for various reasons? Yeah, geographic.
Yeah, exactly, because especially in Morocco, as you see, we have big inequities between provinces, between the rural, between the urban, in terms of quality, but also in terms of supply of services. And one thing that helped us a lot in the implementation of the pilots of the child protection local systems in Morocco is that within the package of the standardized tools, there is also a standardized diagnosis and mapping of the services that need to be implemented in the piloting. So when you do this diagnosis and mapping of services before at the beginning of the launching the pilot, you can adapt the case management to the situation of the supply services in the province or in the community you are implementing in it the system.
Thank you, Karin and Karima. Thanks for those inputs. Yeah, I'm afraid we're running out of time, so I would like to invite the audience to check the Q&A box, because you can see that colleagues have already responded to most of the questions there. And yeah, as colleagues said, if you have more questions, feel free to get in touch. And it's been really great to see all this interaction and interest in this topic. I would now actually like to move to the closing, and we're very glad to have Saman and Javier from the MENA regional office, both regional advisors on social protection and child protection respectively. So Saman, I'd like to hand over to you first, and then to Javier to provide us with some closing reflections. Please, the floor is yours.
Thank you, Charlotte and colleagues. My name is Saman Thapa. I'm the regional advisor for social policy and social protection, as Charlotte said. So maybe first I'll start off by really acknowledging this very strong interest on this topic. As we saw, we had over, I think, 140 participants, at the peak of the webinar. So really want to thank IPC-IG and socialprotection.org colleagues, as well as all presenters, for putting this together and meeting a topic of very high demand. I think from both the webinar and the report that is being that is being prepared that colleagues referred to in terms of integrating child protection and social welfare services, I think there's a very compelling case for taking such an approach, and a lot of evidence indeed in that regard, as well as practical recommendations in terms of how to operationalize that. So from the social protection angle, also in the interest of time, I will just speak to very briefly 3 key takeaways and thoughts in terms of the way forward for the Middle East, North Africa, from the report, the presentation, and indeed the discussion today. The first is the fact that our region, the Middle East, North Africa, is going through significant social protection reforms. We've seen this, due to the impact of the COVID crisis, compounded now by the food and fuel crises. And I think it's just a huge opportunity to shape social protection reforms in a way that takes this more, integrated approach to social assistance, not only looking at the cash component, but particularly also bringing in the child protection and social welfare services. We already saw very practically from the example of Morocco how this can happen, in the context of eventually the rollout of the child benefit and the family allowance, and already how there's active thinking in terms of making that possible. And also, many other countries in the region are at a similar moment. So I think we have really a good moment to make this real through national social protection visions that are being formulated. And also, as Mr. Bainvel recalled at the beginning, the Arab Social Protection Ministerial Forum and declaration signed by 20 countries explicitly calls for this. So I think there is, definitely a need for this and a recognition and opportunities at the country level. The second is the fact that, and this was raised at the beginning of the webinar and throughout, directly and indirectly, is the fact that addressing and social and economic vulnerabilities and reducing multidimensional poverty, which is the core function of social protection, through integrated approach is not just a good idea. It also results in the optimization of efforts, because in many cases, the ministries, the line ministries or departments dealing with social protection and child protection, social welfare are the same, or they're housed at least within the same ministry. So in terms of ensuring a coherent and integrated approach in terms of developing the workforce for such ministries that look at both the administrative aspects of delivering cash, but more importantly also looking at the social welfare and child protection services component and having an integrated social service workforce view will be crucial. And also other systems of delivery can benefit from such a perspective, such as management information systems, integrated registries, as our colleague Karima from Morocco was already referring to. My last point is the fact that, coming down again to what this is all about, at its core, integration of this type promotes better outcomes for children and families. That's what it's all about at the end of the day. And we have a lot more information coming in the report, and we know from global evidence that cash is critical, but it's not sufficient in addressing all economic and particularly social vulnerabilities. So therefore, ensuring this integration from the earliest stages of designing a social protection program, using good evidence in terms of enabling this, like Egypt is doing, as we will see in the report, through the Child Vulnerability Index, will be crucial. So I think there are significant opportunities to make this possible in the region, a lot of interest, also a lot of interest in terms of further evidence needed, which I think we can definitely work on. But really, thank you to all the participants and presenters for such strong interest. And we will, from UNICEF, of course, continue to take this forward. Over.
Javier, please.
Thank you so much, Saman and colleagues, for all the good presentations. And I hope this is just the beginning of this collaboration, jointly with social policy colleagues across the world. For child protection, the paradigm at scale here is really that of moving from policy to implementation. More and more, we see that countries, they do have pretty good policies for the protection of children, but the implementation is really lagging behind. So maybe three big takeaways for child protection. The first is certainly when we hear social policy colleagues, social protection colleagues, is that we need to invest on solid tools, surveys, and systems to assess and identify the most vulnerable children, but at the same time, to measure impact. I think in the child protection sector, we are not always at the forefront of those policy decisions to identify the most vulnerable children. And we need to do this work jointly with social protection colleagues. This will be the best way to inform action to target children with complementary services and community engagement. And when it's needed, this individual follow-up. For us in child protection, it's important that we try to dig deeper into this multidimensional deprivation of children. And as much as possible, we didn't discuss about that, is the co-occurrence of violence against women and children. This is a topic that we need to explore further in the future. In principle, this should be part of the design of social cash transfers and the implementation strategy. We hope that this will be happening more and more in the MENA region and beyond. But we should also focus on those multiple deprivations that are the most likely to translate into negative child protection outcomes, such as child labor and child marriage, among many others. We heard a lot as well about the importance of this harmonization of information management systems while keeping the confidentiality that is so important to child protection, but also to social protection. Now, second and third takeaways for me would be that there are two big streams of work in child protection. One is the individual follow-up. And here we have a significant problem because when we do individual follow-up in child protection, you have a caseload ratio of 1 to 20 clients. We are not yet in this region and many other regions at the scale required to provide that individual follow-up. So this is about expanding the coverage and looking into those numbers. The most child protection is embedded within those important social protection reforms that Saman referred to, the better for children, for families, and for women. So, but importantly as well in this second takeaway on case management and social workers would be that, most of the time you will see plenty and hundreds of social workers doing administrative work. The shift we're talking about here is that of social workers that are able to support families and do individual case management. The third and last takeaway for us in child protection would be that child protection is not only about individual case management. Child protection is as well about social and behavioral change, engaging with communities. And we have evidence here from our own region and other countries in the world where parenting programs, engagement with communities is also another way to add this plus element to cash programs for vulnerable families. So I will end up there, and thanks a lot for this collaboration. I really hope, Saman and colleagues, that this is just the beginning of the journey in this integration, and thank you for all your participation today. Thank you.
Thank you, Javier. Thank you, Saman. Excellent closing remarks and reflections. Yes, with this, we are coming to the end. We went a bit over time, but I hope I believe it was interest to everyone. Thank you to all the speakers for your availability, for sharing your knowledge and experiences. Thank you to the audience for the really very engaged conversations also on the chat box and the Q&A box. If you have the time, please answer the survey. And finally, I would also like to thank our socialprotection.org colleagues for hosting this webinar. And we look forward to the next one. Thank you, everyone. Bye-bye.